For introduction, I will talk about eczema. Eczema is a skin condition in which patches of skin become inflamed, itchy, cracked and rough. Some types can also cause blisters. It is one of many types of dermatitis. Eczema damages the skin barrier function, which is the glue of our skin. This loss of barrier function makes the skin more sensitive and more prone to infection and dryness. It is common in children, but can also occur at any age. Eczema is a long-lasting or chronic and tends to flare periodically. It may also be accompanied by asthma or hay fever. No cure has been found for eczema at the moment, but treatment and self-care measures can relieve itching and prevent new outbreaks. For example, moisturize your skin regularly and apply medicated creams or ointment. Signs and symptoms of eczema can be very widely from person to person, including dry skin, itching, which may be severe especially at night, red to brownish gray patches, especially on the hands, feet, ankles, neck, upper chest, eyelid, or inside the bend of the elbow and knees. Small raised bump, which may leak fluid and cracks over when scratched, thickened, cracked, scaly skin, and lastly, raw, sensitive, swollen skin from scratching.
So this is the example of product for mometasone cream and triamcinolone cream.
Now we move to the use of product. For an effective treatment of eczema, patients should follow all the directions on the prescription label and read all the medication guides or instruction sheet. Use the medicine exactly as directed and do not take by mouth because topical medicine is only used for the skin. Wash your hands before and after using the cream unless you are using the medicine on your hands. Apply a small amount to the affected area and rub it gently into the skin. Do not apply the cream over a large area of skin. Do not cover the treated skin area unless your doctor tells you to. Covering treated areas can increase the amount of medicine absorbed. Patients have to know that they should not use mometasone topical if they are allergic to mometasone. Do not use this medicine on any child without a doctor's advice. Mometasone topical may not be safe to use on a child for longer than 3 weeks. Mometasone topical is not approved for use by anyone younger than 2 years old. Tell your doctor if you have any type of skin infection or diabetes. Topical steroid medicine absorbed through the skin may increase the glucose levels in your blood or urine. It may not be safe to breastfeed while using this medicine. Ask your doctor about any risk. If you apply mometasone topical to your chest, avoid areas that may come into contact with baby mouth. What happens if overdose? Patients should seek emergency medical attention, not expected to produce life-threatening symptoms. Long-term use of high doses can lead to thinning skin, easy bruising, impotence, or loss of interest of sex.
For storage instructions, please store at room temperature between 15 to 30 degrees, protect from light, moisture, and heat. Do not use medication beyond the printed expiry date, keep away from the reach of children, and discard after 28 days. Before taking this medicine, you should not use triamcinolone if you are allergic to it. Tell your doctor if you have ever had any type of skin infection, a skin reaction to any steroid medicine, liver disease, or any adrenal gland disorder. Steroid medicine can increase the glucose, which is sugar, levels in your blood or urine. Tell your doctor if you have diabetes. And please tell your doctor if you are pregnant or breastfeeding. If you apply triamcinolone to your chest, avoid areas that may come into contact with the nursing baby's mouth.
The compare and contrast between the mometasone cream and triamcinolone cream. The first thing first is prescription. For the mometasone cream, it is prescribed for dermatitis, atopic dermatitis, psoriasis, and eczema, while for the triamcinolone cream, it is prescribed for alopecia, allergic reaction, allergic rhinitis, rhinocortical insufficiency, and both of them can be prescribed by prescription only. Next is the drug class. Mometasone cream is a topical steroid, while triamcinolone cream is a glucocorticoid. Third one is the dosage form. For the mometasone cream, it is easy to apply, more moisturizing and soothing. While the triamcinolone cream also relieve itching, relieve inflammation, and also have the moisturizing effect.
So I will proceed for compare and contrast between mometasone cream and triamcinolone cream. First disease interaction for mometasone cream is diabetes, diaper rash, hyperadrenocortism, infection and ocular toxicities. For triamcinolone cream, gastrointestinal perforation, infection, prematurity and vaccination. Second side effect for mometasone cream is acne or pimples burning, itching and pain in hairy areas, dry mouth, loss of elasticity, loss of normal skin markings. For triamcinolone cream, the side effect is aggression, agitation, anxiety, blurred vision, dizziness and headache.
This is the example product for Clodum ointment and clobetasol cream.
Next, I will explain briefly about the Clodum ointment 0.05% uses of the product. First and foremost, Clodum ointment helps to reduce the inflammation and itching on the body caused by eczema or other skin conditions which respond to the steroid medications. So, the users must follow all the directions of use from the prescription label so to avoid any misconception or any bad side effect from happening to them. Other than that, patients also must bear in mind that Clodum ointment is only need to be used on the skin. It cannot be taken orally or be injected inside our body because it will cause a harmful effect to the whole body. Last but not least, the patients that was prescribed with Clodum ointment must read all the medication guides and use it as directed from the doctors, not otherwise.
Next, the direction of use is also important. Firstly, you need to wash your hand before using this medicine to reduce the bacteria contained at your hand. Secondly, you need to apply just a thin layer of medicine to the affected skin and rub it gently, just like how you see in the video. So that's all the tutorial on how to use Clodum 0.05% ointment. Don't forget to wash your hand after using this medicine to avoid any contact with your eye. Next, we will be discussing about the patient information. So the patients must tell the healthcare provider about body or skin condition that they have, such as allergies, skin reaction to any steroid medicine, adrenal gland disorder, or diabetes disease. This is very important to ensure that doctor get the correct information regarding the patient's condition and to ensure that the treatment is successful. Other than that, we must bear in mind, do not apply the medicine over a large area of skin unless directed by the doctor. Last but not least, avoid use this medicine on child without any medical advice to avoid bad side effects from happening to them.
Next, we can use clobetasol 0.05 cream to relieve eczema. How do we use this product? First of all, wash your hand before applying this cream, and then apply a thin layer to affected area. For example, we put this and then we rub it gently and completely. Use this cream twice daily. After that, do not cover the treated area with a bandage or other covering unless your doctor tells you to. This is because covering treated area can increase the amount of medicine absorbed through your skin and may cause harmful effects. The maximum dose for this cream is the total dosage should not exceed 50 grams per week. And this is because clobetasol is classed as a super potent corticosteroid. Now we continue with the patient information for this cream. What happens if I miss a dose? Apply the medicine as soon as you can, but skip the missed dose if it's almost time for your next dose. And do not apply 2 doses at a time. And what should I avoid while using this clobetasol? First, avoid applying clobetasol topical to your face, underarm, and groin area. And secondly, do not use this medicine to treat any condition that has not been checked by your doctor. And besides that, avoid using other topical steroid medication on the areas that you treat with clobetasol unless your doctor tells you to. Next, we continue with the compare and contrast between Clodum ointment 0.05% and clobetasol 0.05% cream. Clodum ointment prescribed to use on skin to treat inflammation and itching caused by psoriasis, eczema, or any other skin condition, while eclloclobitazole prescribed for dermatitis, atopic dermatitis, eczema, dermatological disorders, and both this ointment and cream can be prescribed by prescription only. The drug class for clodum ointment and clobitazole cream is the same, which is topical steroid, and the dosage form for clodum is ointment, which is used only on skin and it can keep skin hydrated and moist, while eclloclobitazole is available in cream and it easily absorbs to skin and protection against moisture loss.
Next, I will compare and contrast the clodum ointment 0.05% with eclloclobitazole 0.05% cream. Both clodum ointment and eclloclobitazole cream have the same disease interactions, which are diabetes, diaper rash, hyperadenocorticism, infections, as well as ocular toxicities. For the clodum ointment 0.05% side effect are dry skin, itching, burning, acne or skin rash, and increase in hair growth. For the eclloclobitazole 0.05% cream side effects are cough, sore throat, body ache or pain, changes in skin coloring, dryness of the throat, skin discomfort, and tender or swollen glands in the neck.
These are the products: Elidel 1% cream and Disonite 0.05% cream. Elidel 1% cream is indicated for the short-term treatment and intermittent long-term therapy of mild to moderate atopic dermatitis non-immunocompromised patient who age 2 years and older. How Elidel 1% cream works? It will work in the cell in the skin that cause the inflammation and characteristic redness and itching of eczema. It is because in Elidel 1% cream, there are main active ingredient known as pimecrolimus, which is an example of anti-inflammatory agent that can inhibit the production and release of pro-inflammatory substance that help in reduce the inflammation and also redness. For the use of the product, what you need to do is just follow the direction of use from the prescription label and also advice from the pharmacist. Elidel 1% cream also may be used on all skin area, including the head and face, neck, and also any intravenous area. So for the application of Elidel 1% cream, what you need to do is just apply a thin layer onto the affected skin twice daily. For example, like once in the morning and also once in the evening. So then the cream, you need to rub it gently and completely. So I also attach the example video on how to use Elidel 1% cream. So this is just example video. So usually Elidel cream will come out with really flexible tube and with a cap. So what you need to do first is just open the cap. And usually on top of the lid there will be kinda like aluminum foil seal where it's functionally used to avoid any contamination. So you need to open the seal and then squeeze out a bit of the cream. And then after you get the cream, you just gently rub onto the affected skin, completely cover it. So and then you just need to replace back the cap to the original place. So for the precautional use of Elidel 1% cream, and this is the most important part where all the patient need to pay more attention with. First, do not apply the cream to the area of the skin affected by active viral infection, for example like cold sores. And next, you need to wash your hands after using Elidel 1% cream, because if you don't wash your hands, there will be high possibility that you might accidentally rub your eyes, and there will be contact between your eyes and also the cream that will cause pain and also burning sensation for the patients. And next, if any sign of improvement has not noticed after 6 weeks of treatment, stop the treatment and go consult the doctor. And lastly, do not bath, shower or swim right after the application because it might wash off the cream that you just applied. So for the side effect of using Elidel 1% cream, the very common side effect is application site will feel burning and itching. And the common side effect is the application site will cause reactions such as irritation, itchiness, and a big redness, and skin infection. And the uncommon side effect are worsening of the condition, virus infections such as herpes simplex, skin inflammations, rash, pain, dryness, and a big swelling. And for the rare side effect are allergic reaction and also skin discoloration. For the rare side effect that caused by allergic reactions, you need to tell your doctor or pharmacist if you have any allergic towards the ingredient in Elidel 1% cream. So for the storage of Elidel 1% cream, what you need to do is just keep out of the reach and sight of the children, because children tend to get curious and they put all sort of things into their mouth, even including the cream, which is quite dangerous. And next, do not store your cream above 30 degrees Celsius and freeze them. Once you open the cream, the content of the tube should be used within 1 year. And then store your cream in the original package and keep the tube tightly closed. And lastly, do not use your cream after the expiry date because it might not effective or a bit risky for the patient to use anymore.
Hi, so let me explain with you with another product which is Desonite 0.05% cream. So firstly, what is the use of this product? First, it helps to reduce inflammation in the body. Second, it used to treat inflammation and itching caused by eczema or skin conditions that respond to steroid conditions. And last but not least, it may also be used for purposes not listed in this medication guide. The usual dose for eczema is apply a thin film to the affected areas 2 to 4 times a day depending on the severity of the condition. The duration of therapy is 2 weeks. So how to apply this product? So make sure to wash your hands before you apply the cream. And then apply a thin layer to affected area twice daily, like this. Let me show you the example. So apply a thin layer to the affected area and then gently rub in until it completely absorbs really well. After that, wash your hands after apply the medicine unless your hands are being treated. Okay, then I will continue with the precaution when using this product. So firstly, avoid getting Desonite topical in your eyes, nose or mouth. And then, do not use Desonite topical to treat any skin condition that has not been checked by a doctor. And then, follow all the directions on the medicine label and package. Last but not least, do not give this medicine to a child without medical advice. So, what is the side effects when using this product? So, firstly, it will cause stinging or burning of treated skin. Second, it will cause skin irritation, redness, itching, or hardening. Third, it will cause dry, scaly, or oily skin. Number 4, it will cause swelling in your hands or feet. Last but not least, it will cause acne, stretch marks, or crusting around your hair follicles. Next, when you want to store this product, make sure to keep out of the reach of children. Store the medicine in a closed container at room temperature, away from heat, moisture, and direct light. Next, make sure to keep the bottle or tube tightly closed when not in use. Lastly, do not keep outdated medicine or medicine no longer needed. I will explain with you what is the differences and similarities between Elidel 1% cream and Desonite 0.05% cream. For the prescription, Elidel 1% cream prescribed for atopic dermatitis and eczema. It may also be prescribed off-label for perioral dermatitis. While for Desonite 0.05% cream, it prescribed for atopic dermatitis, eczema, dermatitis, and psoriasis.
The drug class for Elidel 1% cream is miscellaneous topical agents, while for Desonate 0.05% cream is topical steroids. The dosage form for both of them is topical cream.
I will continue compare and contrast between Elidel 1% cream and also Desonate 0.05% cream. Disease interaction for Elidel 1% cream are immunosuppression and also skin malignancy. Meanwhile, disease interaction for Desonate 0.05% cream are diabetes, diaper rash, hyperadenocorticism, infection, and also ocular toxicities. Side effects caused by Elidel 1% cream are swollen hair follicles, localized burning, stinging, tingling, or soreness of treated skin. The patient also will feeling more sensitive to hot or cold temperature. Meanwhile, the side effect from Desonate 0.05% cream, the patient will feel burning, itching, redness of the skin, irritation, swelling, peeling of the skin, stinging, and unusually warm skin.